Hey everyone, welcome back to Shalonda's Nursing Corner. If you're new here, I'm a registered nurse, and this is part 5 of our Pharmacology Series. So far, we've covered Part 1, Pharmacokinetics, Pharmacodynamics, and the rights of medication administration. Part 2, Drug classifications and common medication types. Part 3, Medication safety, nursing interventions, and preventing errors. Part 4, medication calculations and dosage conversions. Now in Part 5, we're talking about drug interactions and contraindications because some medications should never be mixed. Stick around for a quick quiz at the end to test your knowledge. Let's get started! Drug interactions happen when two or more drugs affect each other, changing how they work in the body. Some interactions can be harmless, but others can be dangerous or even life-threatening. There are 3 major types of drug interactions. Drug-drug interactions, when two drugs react with each other. Drug-food interactions, when food or drinks affect drug absorption. Drug-disease interactions, when a drug worsens a medical condition. Let's break these down one by one. Certain medications should never be taken together. Here are some of the most dangerous drug combinations nurses need to watch for. Warfarin plus aspirin per NSAIDs. Increased bleeding risk. Both are blood thinners. ACE inhibitors lisinopril plus potassium-sparing diuretics spironolactone can cause dangerous hyperkalemia, high potassium levels. Benzodiazepines lorazepam plus opioids morphine can cause severe respiratory depression. Antibiotics ciprofloxacin plus antacids. Antacids block antibiotic absorption, making the drug less effective. Nursing tip: always check a drug reference guide before giving new meds together. Some foods and drinks can change how medications work. Let's look at a few key examples. Grapefruit juice plus statins, atorvastatin, simvastatin, can cause toxic levels of the drug in the body. Leafy greens plus warfarin, high vitamin K levels can reduce warfarin's effectiveness, increasing the risk of clots. Dairy plus certain antibiotics, tetracyclines, fluoroquinolones. Dairy can block absorption, making the antibiotic less effective. Alcohol plus CNS depressants, opioids, benzodiazepines, antihistamines can cause severe drowsiness and respiratory depression. Nursing tip: always educate patients on food restrictions with their medications. Some medications can make certain medical conditions worse. As nurses, we need to be aware of these risks. Beta blockers, metoprolol plus asthma. Beta blockers can worsen breathing problems in asthma patients. NSAIDs ibuprofen plus kidney disease. NSAIDs can further damage the kidneys. Decongestants pseudoephedrine plus hypertension can increase blood pressure, making hypertension worse. Metformin plus liver disease can increase the risk of lactic acidosis, a dangerous condition. Nursing tip: always check a patient's medical history before giving medications. Nurses play a huge role in preventing dangerous drug interactions. Here's what we can do: review medications, always check for potential interactions before giving new meds. Ask about herbal supplements. Many patients take over-the-counter supplements that can interact with prescriptions. Educate patients, teach them what foods, drinks, or meds to avoid. Monitor for side effects. If a patient starts showing unusual symptoms, consider a drug interaction. Nursing tip: use resources like Lexicomp, Micromedex, or Epicrates to check for drug interactions. Let's see what you've learned. I'll ask a few questions and you'll have a few seconds to think before I reveal the answer. Question 1. Which food should be avoided with warfarin? Answer: leafy greens high in vitamin K can reduce warfarin's effectiveness. Question 2. A patient with asthma is prescribed a beta blocker. What's the concern? Answer: beta blockers can cause bronchospasms, worsening asthma symptoms. Question 3. A patient taking statins asks if they can drink grapefruit juice. What do you say? Answer: no. Grapefruit juice can increase statin levels and cause toxicity. Question 4. Which drug combination increases the risk of severe respiratory depression? Answer: opioids plus benzodiazepines, e.g. morphine plus lorazepam. And that's a wrap for part 5 of our pharmacology series. Today, we covered drug-drug interactions nurses must know, drug-food interactions that can affect medication absorption, drug-disease interactions and why some meds worsen certain conditions, how nurses can prevent dangerous interactions. In part 6, we'll dive into how to handle medication errors and adverse reactions, an important skill for every nurse. If you found this helpful, don't forget to like this video and subscribe so you don't miss the next one. Thanks for watching Shalonda's Nursing Corner. See you next time!